As a doctor, I experienced the pain points of medical devices in general practice firsthand. Speaking to my colleagues, I realized they are sharing the same concerns. GPs are using 3 devices: otoscope, ophthalmoscope, dermatoscope. Current otoscopes can't be used to remove earwax as the lens is blocking off access. Instead, GPs have to use ear syringing, which induces risk to the patient. Doctors want the best care for their patients. Therefore, there's an increasing trend in GPs are buying expensive and bulky ear microscopes or sending patients away to specialists. The need of being referred for earwax removal or foreign body removal from the eye costs patients extra time and money. GPs also miss out on revenue. Particularly small GP practices rely on these kinds of services to remain financially viable. Medicare rebates for doctors are not keeping up with increasing expenses over the last decades and put a financial burden on practices. Commonly, current medical devices in general practice are analog. Image transfer to the computer or colleagues is complicated or not possible, and documentation requires lengthy written descriptions. Additionally, examinations of eyes and ears require very close contact to the patient. This is not only uncomfortable for doctors and patients, but in the recent times we learned how important distancing has become. This made me think of a solution. I invented a procedural otoscope for the GP and that works similar like an ear microscope found in the offices of ENT specialists or hospitals. It has also additional features of digital technology and image-taking capabilities. But quickly I realized that the same device not only can be used as an otoscope, but also as a dermatoscope, an ophthalmoscope, or a GP version of a slit lamp. After many iterations, the iScope found its current design and is now progressing to prototype development. It has a digital camera, a high-resolution screen, and wireless connectivity. It will be designed for easy and quick data transfer to the patient's file. It will be designed for examination and billable procedures, all in a single device. The iScope has the advantage that examinations can be comfortably performed at arm's length distance. Getting procedures done by the GP instead of specialists will be convenient for patients and saves them money. Having designed the device, I wanted to be able to buy one for myself. As a physician and enthusiastic innovator, I knew I had to bring in expertise. To ensure that I have the right skills and knowledge in the company for all aspects of the commercialization of iScope, I've engaged Mark Morwood and the Ontogo team as partners. JD Sanmed conducted a survey with GPs which indicated a strong need and interest as well as good price acceptance. We were selected by the Medical Device Partnering Program as a part of the collaboration between industry and academia. Right now, we are engaged in building a proof of concept prototype. One of the first steps I took with the Ontogo team was a deeper assessment of the market potential for the iScope. The iScope has a unique selling point and a strong defensible IP with focus on procedures. There's a big market, which means medical devices for GPs have a constant and high demand. Initially, we will be focusing on GPs in selected countries and will be directly targeting doctors in our marketing. Our sales will be through distributors, which is the established way for medical devices. But over time, we will look into direct online sales. We secured the IP with an international patent application under the PCT, and we will secure the IP in targeted countries individually. Having the IP secured gives us the best competitive advantage to bring the iScope to the market. Our main focus is to bring the iScope further, which means progressing our prototyping. We also have to prepare JD Sanmed for further funding rounds, which includes a lot of background work. We believe with your investment, we can be a global leader in digital medical device solutions in just a few years' time. We'd love for you to come on board and be part of the next stage of our journey. We are inviting supporters who see the value of the iScope to share JD Sanmed's success.